Hi, I'm Chris Johnson, a board-certified oral and maxillofacial surgeon and owner of Johnson Full Arch Implants. Today I want to just discuss the different options that we have when it comes to that terminal dentition phase, when your dentist tells you that we have to kind of move and your teeth are non-restorable or there aren't any other options, and so they want to transition you into almost like a denture case scenario where they have determined that the rest of your teeth just are not salvageable. So the first thing, and we'll kind of work step by step at the different evolutions of treatment, but the first is of course a full denture. This makes people cringe, but basically I'll show you kind of what a denture is. This is a maxillary denture, and it's also, people call it a hockey puck because of how big and how much material there is. And so the only support that a full denture uses is the suction on your gum tissue, and it kind of rests on your pre-existing bone. This is very limiting on the amount of food and the types of food you can eat. There's really not any retention or any reason for it to kind of stay on. So that you have to use adhesives like denture glue, and it can be dislodged while you're eating. It can be dislodged during talking or conversation. It can be a social stigma just by hearing the word denture. The other thing that it does is it causes a lot of bone loss on the jaws, and it kind of collapses our smile because over time that bone is not being utilized, and it's actually, because it's resting, it's just kind of rubbing on it, and over time that can atrophy or that bone can disappear. And that's why you see those exaggerated photos of somebody that's been wearing dentures for many years, that they don't have the bony support. And if you don't have the bony support, then you don't have the lip support, and it's very unaesthetic when those patients are not wearing their prosthesis or their denture. The other thing is that food gets caught. You know, think of it while you're eating, food's getting trapped up here, and so after you eat, you have to go and take these out and clean on the underside of it. When you have a bottom denture, it doesn't even have this palate here, so it's really resting, and just imagine the tongue, and every time the tongue moves, it's moving all over the place. And so a bottom denture looks like this. And can you imagine your tongue resting in between, and every time you talk or every time you eat or your tongue moves, it's dislodging this bottom denture or mandibular denture. It's kind of the option of the past. The next thing is, if somebody still has a few teeth that they can salvage, then they do what's called a partial denture. And a partial denture is where they use some of the existing teeth and they clasp kind of the teeth in between. This is still, it's relying on the teeth for support. There's visible clasps that go around the teeth. A lot of times these are made out of metal and are very unaesthetic. You're still limited on what you can eat. It puts high stress on your existing teeth and can lead to further failures. And if you ever have to have another tooth extracted or have any work done, this whole thing has to be remade. So once again, probably there's better options out there than a partial denture. The next option is kind of a hybrid. It is where we basically put 2 implants on the bottom to kind of act as anchors. And what those implants do is, on the underside of a mandibular denture, we're able to put these O-ring adapters, kind of like a trailer hitch of a car. And so what happens is when they go on there, they snap in place. And now they have the retention. They're still relying on the bone. They're still resting on the bone itself, but those little anchors just have a little bit more retention, so they're not dislodging all over the place. The most common scenario is when we put just 2 implants in the anterior, because if we put any more than that, then we can just go to a fixed kind of all-on-X procedure. The important thing to note about this is it's only for the mandibular arch or the bottom teeth or the bottom jaw. We don't do these. In fact, I would strongly warn you to not do them for the maxillary arch, because the bone on the maxillary arch is a little less dense, it's a little softer. And if you put those implants in and you're torquing side to side, over time you'll get cusping or bone loss around the implants, and it's a high increase chance for failure rate on the implant. So don't do a removable prosthesis or an implant supported prosthesis on the maxillary arch or on the top arch, because over time it has led to failure. We learned that. We used to do them all the time probably about 10 years ago, and most people are staying free and clear from doing them on the maxillary arch. Okay, the next thing that we'll discuss, and it goes by all different names. It can be called All-on-X, it can be called All-on-4, it can be called an implant retained hybrid prosthesis. But basically what it is where the implants, either 4 to 6 implants, are placed in an arch, and now the entire arch of teeth rest directly on the implants themselves. And so they're not actually resting on the gum tissue. It kind of makes a margin, or it meets the gum tissue. And so this allows for you to regain most of your chewing force so that you can eat the foods you want. It is very normal place and commonplace to eat foods like raw vegetables, raw fruit. And so that way it's overall healthy for you, because then you can maintain a normal diet and get the nutrition your body needs. The other thing is it's very natural looking. These are made out of, well, this is a plastic set because it's a model, but the finals are made out of zirconium, which is a ceramic-based material. That's a very aesthetic, kind of clean, very biocompatible and hygienic solution. And when you compare this with a full denture, and here's another denture, you can see just how much less material and how more streamlined they are than a conventional denture. You also don't have that palatal strut, and that palatal strut can interfere with talking or pronouncing words, and then it loses the suction. The other thing is this is permanent, so you cannot remove these. Your dentist or restorative doctor can remove these, and they can remove them by, there's little access holes. You won't ever see these because these will be filled up with a composite white colored material that blends in with your teeth, but they will go in and they will actually unscrew little set screws, and then this comes off, and so they can professionally clean underneath it or around the implants. Another huge advantage of doing this is it maintains the bone structure and the strength in your jaws. Because the implants are placed directly into the bone, your bone is almost tricked where it thinks that it's still being utilized, and so it still needs to maintain its integrity, and so your body continues to make that volume. And that in turn makes it where it supports your smile and your face. It's much more hygienic, kind of what I discussed. You don't get a bunch of food caught underneath there. You can use a water pick, or you can use super floss. I have another video that talks about how to maintain and take care of your All-on-X procedure. Plus, it's a great value. I mean, for the cost of getting this, you know, it is more than a full denture, but the advantage of doing that versus individual implants or kind of doing a full mouth crowns and bridge, this is a very good option for many people that are at that terminal dentition stage. So I hope this helps. I hope this explains the differences, and it talks about the advantages and the disadvantages of the main different treatments that we are using. Now there's different variations of each one of them, but this is kind of an overview that just talks about what our options are when we get that dreaded consultation where your dentist or restorative doctor says that we're kind of running out of options and we need to kind of engineer for the next solution for you. Thank you. I appreciate you listening to this, and if you have any questions, don't hesitate to contact us. And that's Chris Johnson at Johnson Full Arch Solutions. Thank you. Bye.